assembly services on substrates for Tier 1 automotive suppliers. The company opened its Clark County facility less than a decade ago, but it's already become an important and critical part of that community. Tyca's initial investment in Winchester planned for the creation of 30 jobs at about $22 an hour. But to date, the company has created 44 jobs, paying an average hourly wage of $26 an hour. And they're not finished growing yet. I am happy to share that Tyca now plans to expand the Clark County operation with a $4.4 million investment that's going to create another 20 good-paying jobs. Like many industries, it's been a difficult year for the automotive sector. So I am all that much happier to see the continued success of companies like Tyca. Kentucky is home to more than 520 automotive suppliers that cover nearly every aspect of the industry. Tyca's announcement today adds to the more than 100,000 Kentuckians employed by automotive-related businesses. The industry's continued growth and the creation of quality job opportunities with strong wages will be crucial in our recovery from this pandemic. So the commitment of Tyca and other auto suppliers to our state is greatly appreciated. So thank you to the leaders of Tyca Cubic Printing Kentucky and to everyone who had a role in this expansion. And congratulations to Winchester and Clark County on the growth of a great company. Today, we also have some good news for Eastern Kentucky. I'm excited to announce a $450,000 grant from the Appalachian Regional Commission's Distressed County Infrastructure Program to upgrade wastewater infrastructure in Middlesboro. This current system is 34 years old and frequently fails, requiring expensive repairs. Middlesboro will use the funding to update the main sewage lift station and address aging pumps at the wastewater treatment plant. Upon completion, the upgrades will save the city $17,000 annually in operation and maintenance expenses, and it's going to provide better wastewater service for 605 businesses and more than 4,300 households. Clean drinking water is a basic human right. And even in the midst of this pandemic, this administration with our federal partners have been investing, especially in areas that haven't seen that steady supply of clean drinking water. We have put dollars upon dollars into Eastern Kentucky to try to correct decades long failure to give people that basic human right of clean water. This is a big part of how we build stronger communities and prepare for our future post-COVID. So congratulations to Middlesboro on the award, and thank you to everybody who worked on it and made it possible. Because of your work, I'm confident we'll build a stronger, better Kentucky. All right, this next one, I don't know if you all have seen the news on, but it's a big one. So today, the Commonwealth is in an even stronger position to help Kentuckians as we emerge from this pandemic after the Kentucky Supreme Court reinstated an almost $1.3 billion award for the Commonwealth of Kentucky in a judgment against PokerStars. That's right, $1.3 billion. Supreme Court reinstated the Franklin Circuit Court judgment, concluding the Commonwealth's decades-long fight against illegal offshore internet gambling. This will never be enough to make up for the damage to Kentucky's families and the states from the years of irresponsible and criminal actions. But this is a good day for Kentucky. This better positions us to emerge from this painful pandemic, to help Kentuckians, to help our businesses, to provide quality health care to more Kentuckians, to strengthen our public schools and keep our promise to educators and other public employees, some of whom have been on the front lines battling the fallout from this company's greed. I also want to congratulate J. Michael Brown, my executive cabinet secretary, for bringing actions on behalf of the Commonwealth in 2008 in this matter, when he was the secretary of the Justice and Public Safety Cabinet under another Beshear, seeking to stop the unregulated, untaxed, and illegal offshore gambling operations that were operating in Kentucky. Once the Kentucky Supreme Court's opinion is final, the Commonwealth will take aggressive steps to collect the judgment for the benefits of all Kentuckians. And I'm going to admit, Michael and I have both been lawyers for much of our career, and coming into this job, I'd had the good fortune of securing one of the larger verdicts in the last 20 years in Kentucky of 11.4 million. Well, I think Michael's case just brought in 1.3 billion. So I think once again, he gets that first place prize, but I'm continuing my best to try to learn as much as I can from him. All right, the Healthy at Home Eviction Relief Fund is closed to applications. We had to close it today at noon, and that's because we now have 396 completed applications, and that's going to grow as some tenants and landlords call in and complete their applications. Remember, we had $15 million to help people, to make sure they didn't kicked out of their home, and to make sure that they didn't emerge from this pandemic with significant debt. We are going to spend all of those dollars, all 15, and we're going to help at least 3,477 households. I think that number will be more like 3,700. All right, let's go to the best news we've been having recently, and that's vaccines. So yesterday, we were happy to confirm all 11 of the hospitals that Kentucky set to receive the initial delivery of vaccines have confirmed their receipts. These hospitals included Pikeville Medical Center, Baptist Health in Madisonville, Corbin, and Louisville, as well as Mercy Health Lords in Paducah. Here are some of the pictures of our frontline heroes being vaccinated with what I believe is a miracle, a 94 to a 95% effective vaccine. And remember, these folks are folks working on COVID wings that go in every day knowing they can contract this virus, but they want to help your loved one to make sure that they can get better. So here you can see the first vaccine in Paducah being given to Dr. Bradley Albertson, a physician double certified in both internal medicine and pediatrics. Let's watch. All right. You see everybody clapping? I got to tell you, there is a new energy amongst our frontline workers, seeing how quickly this day came, and knowing that as we move into 2021, we are going to defeat this virus. We are going to win. We have to take care of each other until we get there. I want to go just a little out of order, Jim, and let's show the vaccine update about when we're going to be receiving other shipments. So all these pictures you've been seeing, which they're truly amazing, and they ought to give you hope. You ought to stay vigilant, but they ought to give you hope in a second wind. Everything you're seeing right now is part of the first allocation that came to Kentucky the week of December 13th through the 19th, and that's our first 38,025 doses from Pfizer. About 2/3 of that went to long-term care, and the rest went to those 11 hospitals. So the new news today is Pfizer has confirmed a second shipment for next week of 27,300 doses. Now, the majority of this, and I'll explain in a minute, is going to go to our long-term care program. And we're excited that a second shipment was finally confirmed. I will say that this is lower than we anticipated based on the first allocation. And we'll be watching that as we move forward, because the speed at which we can vaccinate long-term care, the speed at which we can get back to something like normal depends on the amount of the vaccine that we get. And it's by and large out of our control, but I want to make sure that I am transparent when we receive numbers about what we'll get and if they're changed on us. So that same week, Moderna, we believe we'll get the initial allocation of 76,700. The vast majority of that are going to acute care hospitals all over the Commonwealth, so that every acute care hospital that is treating COVID patients either gets it to administer itself, or a partner hospital that's gotten all the way through the system, if the other one hasn't, will get their amount so that they can provide those vaccinations. But every acute care hospital, we believe next week, will have a certain number of vaccines for their frontline healthcare workers. And then we believe that the week of December 27th through the 31st, we will get 33,800 more doses of Moderna. Now, this is just December. And this, again, doesn't get us through our frontline healthcare workers or through long-term care. So what we'll see is, in the very least, the first couple weeks of January, if not all of January, we'll still be going to those most at-need populations. So everybody stay patient. It's a wonderful day. We can see the end in sight. And it's also a little scary knowing how bad COVID is right now. And there's a vaccine out there, and you want it, especially during this most dangerous time. But those who are part of our healthcare capacity need it first so that they can be in that hospital if one of your loved ones needs their help. And then those that are disproportionately dying, long-term care residents, which make up almost 66% of all deaths in Kentucky, again, need to come first. Now, there's a lot of questions out there about who's next after this group. And the answer is the federal government hasn't come to terms with that yet. I will show you in a minute some statements from the White House task force, especially as it comes to age. And if the number one thing is to stop deaths in fighting COVID and how we distribute the vaccine, then age is the most effective manner at rolling out the vaccine, if that is the ultimate goal. So today we are also starting our vaccine campaign so that we can provide information to Kentuckians and build their confidence in these amazing vaccines. So there are a couple phases of the campaign. First is education. There we want to assure awareness and public confidence about the safety and efficacy of COVID-19 vaccines. Second, we want to ensure understanding of the phased rollout of the vaccine when that information is available. And that requires patience too. And third, we want to help Kentuckians know that by visiting kycovid19.ky.gov, they can get trusted information about the vaccine. There's going to be an update to our vaccine page and information there on Monday. After the education portion after the education phase of the vaccine campaign comes the engagement phase. That's engaging with Kentuckians, especially discrete population groups, through the correct channels to encourage commitment to taking this vaccine. Messaging will be shaped based on what we learned through community outreach efforts with Black, Hispanic, and rural populations specifically. What we learn in these discussions will help shape how we openly, honestly, and effectively communicate with those populations and ensure that there is an equitable rollout of this vaccine, that everybody gets protected, and that we not only provide the information, but we provide it in the best way to get as many people protected as possible. Our goal for the campaign is to remind Kentuckians that no one likes the idea of getting a shot, but shots are just a small fact of life. Why? Because a shot is, and always has been, the end of wondering what might happen. And this little shot does more than keep you from getting sick. It gets folks back to work. It gets your kids back in school. It gets our economy up and running again. It's the road to getting back to so many things that we enjoy. It's a shot of relief. It's a shot of hope. As the FDA authorized vaccines continue to arrive in Kentucky, all you have to do is do your part. We can't all get the vaccine at once, but we'll all get a turn. You can find all the facts at kycovid19.ky.gov. I think Jim jumped the gun a little bit. I was about to introduce our first video, which you've been watching as I've been talking. I can't blame that one on Kenneth. All right, we're going to run it again. So here's a look at our first general message advertisement that'll be hitting the airwaves soon. It'll come with audio when it does. So let's go ahead and play it.
It's just a little shot. But the COVID-19 vaccine does more than keep you from getting sick. It will get folks back to work, get our kids back at school. It's a shot of relief of hope. All we have to do, Kentucky, is keep doing our part. We can't all get the vaccine at once, but we'll all get a turn. Get the facts at kycovid19.ky.gov.
It's a lot better when we play it at the right time. So that's just the first of the messaging as it will roll out. And that part of keep doing your part is so critical because we still have very high levels of COVID. It's still taking a lot of lives. In fact, today, I believe it's taken 54 lives. So let's keep doing our part to protect one another until everybody gets a chance to get this vaccine, a shot at getting their shot. Want to go over some of what the White House report this week says. First, in their summary, the White House Coronavirus Task Force sees what we're seeing in our numbers, that despite the nation escalating dangerously, we have seen a stability, that'd be their way of saying a plateau, in new cases and a decrease in test positivity. That means we are doing better while the rest of the nation is doing worse. Here's what we showed in the map just on Monday, that hospitals are reporting critical staffing shortages. We showed it more in ICU beds and how many are taken, but the state is managing. In other words, we're at a dangerous place, but we are not over the tipping point yet. It's one of the reasons we're prioritizing the vaccine for our frontline healthcare workers, but it's also why we need your help. Couple of other points. They talk a little bit about the vaccine and their current thinking, especially as we get past the stage they're in. They ask us to ensure comprehensive analysis of next tier priority of vaccinations, understand immunization of individuals over 65 will have the greatest impact on hospitalizations and deaths. In other words, if we want to cut down our deaths as quickly as we can, after long-term care, they're suggesting we look at Kentuckians 65 and up. That'll reduce deaths and also create more hospital capacity for everybody else who might get sick. And then they give some pretty startling statistics, if you haven't seen them, for those over 70 with COVID infection. 20% or more that get the infection are admitted to the hospital. Nearly 10% die. You got to think, for those over 70, this thing is 10 times more deadly than it is to the rest of the population. So this is advice from the White House Task Force, and these are considerations they're asking us to take as we look at the next tier. Also, a couple other warnings here, and significant warnings. That at this point, if you're over 65 or with a significant health condition, don't go to any indoor public space where anyone is unmasked. The White House now says that is an immediate threat to your health. So make sure you get groceries delivered or have them brought to your car and your medications delivered. That's where we are. If you're over 65 or you have one of these medical conditions, don't go to any place that is not enforcing a mask mandate for everybody inside. And for those who continue to refuse to wear masks and want to be served in facilities, the White House is saying you are a deadly threat to anyone over that age. Please wear that mask when you go out. And if you're under 40, assume you became infected if you gathered beyond your immediate household. Again, this is saying that we shouldn't get out with those outside of our household. Again, a couple more that you can read here. But the final one, warn about any gathering during December holiday. In other words, this Christmas, which is certainly one of my, if not my favorite day of the year, do it with your immediate household. Do it with those that you live with. Remember what Christmas is about, and remember the example that Jesus set in his teachings about caring for one another. Let's not do Christmas in a way that would dishonor loving our neighbor as ourselves. Let's make sure that we do the right thing over this holiday to protect those we love and all of those around us. All right, today's report is 3,349 new cases of COVID-19. Now, that is a lot, but it is still less than last week. And our positivity rate is down a little bit, but it's still pretty flat at 8.45%. Hospitalization up a little bit, 1,817. 431 Kentuckians in the ICU, 254 Kentuckians fighting for their lives on a ventilator. New cases by county, Jefferson, 475. Northern Kentucky has gotten hit hard. Kenton, 178. Boone, 171. Campbell, 119. Fayette is here with 126. Pulaski County, multiple days of high cases, 106 today. Hardin, 103. Davis, 94. Madison, 86. Warren, 80. Wayne County, 70. Laurel, 57. McCracken, 57. Shelby, 57. Pike, 56. Oldham, 48. The others can be found on kycovid19.ky.gov, but every single area in the state has multiple counties with 30 or more cases. Remember, it's everywhere. All right. So our death report today is going to be one of the hardest since early on. It's by far the most people that we've lost. And remember, that's a reflection of where this virus was about 3 weeks ago and where it was trending, because increase in deaths follow increase in cases. More people get infected, a percentage of those will be hospitalized, and a percentage of those will die. So the more people who get infected, the more people need to go to the hospital, and the more people don't make it. I hope we don't have another day where we have 54 deaths. And this is going to be hard because these are 54 families that need our help and our compassion and our green lights, which is the color of compassion and renewal. They also need us to do better, to follow the rules, to follow the restrictions, because if you don't know someone who's been lost to COVID, if someone close to you hasn't been lost to COVID, or someone close to someone you know, then you're not listening, because it has happened all over Kentucky. Far, far too much loss. So today's loss include 2 individuals from Bullock County, both men, 167 and 172. They include a 94-year-old woman from Callaway County, an 83-year-old woman from Carroll County, a 47-year-old man from Casey County, an 81-year-old woman and a 69-year-old man from Christian County, 97-year-old woman and an 82-year-old man from Clinton County, 76-year-old man from Davis County, 92-year-old woman from Fayette County, an 88-year-old woman from Graves County, a 63 and a 68-year-old woman, both from Grayson County, an 85-year-old woman from Hardin County, 94-year-old man from Henderson, 85-year-old woman from Hopkins, a 64-year-old man from Hopkins, and a 98-year-old man from Hopkins. From Jefferson County, an 82-year-old woman, a 97-year-old woman, a 47-year-old man, an 87-year-old man. From Jessamine County, an 85-year-old woman and a 55-year-old man. From Johnson County, a 77-year-old man, a 66-year-old man from Kenton County. That's halfway through. 75-year-old woman from Knott County and a 79-year-old woman from Knott County. 75-year-old man from LaRue, 88-year-old woman from Logan, 88-year-old woman from McLean, Madison County. Madison County lost a 76-year-old woman, an 85-year-old woman, a 90-year-old woman, a 99-year-old woman, a 77-year-old man, and an 89-year-old man. Our hearts go out to Madison County today. From Mason County, an 83-year-old man and an 87-year-old man. From Monroe County, a 76-year-old man. From Muhlenberg County, an 81-year-old woman and a 77-year-old man. From Nelson County, a 61-year-old woman and a 52-year-old man. From Oldham County, 3 men, ages 75, 86, and 95. We lost 2 men from Robertson County, a 70-year-old man and an 87-year-old man. In Russell County, we lost a 63-year-old man. In Spencer County, we lost a 92-year-old woman. In Union County, we lost a 73-year-old woman. And in Washington County, we lost a 58-year-old woman. That hurts to read, but it doesn't hurt nearly as bad as these families are right now. This is a tough way to pass, not being able to be close to family. And it's even tougher to mourn. So let's be there for these families and let's recommit to do the right things so there are fewer families that go through this. Long-term care facilities, 194 new residents testing positive, 126 new staff, 35 additional deaths attributable to our long-term care population. Right there is why they are in the very first tier of those getting this vaccine. All right, well, we're going to move over to Dr. Stack, who's going to give us some winter guidance, and then we'll answer questions.
There we go. Now I'm off mute. Hi, Governor. Thank you very much. Thanks, Virginia, for acknowledging you can hear me. So my job here today is to talk to you about holiday guidance and then a few closing points after that. So James, do you have the one slide we have for tonight? So as we look to the Christmas and Hanukkah and Kwanzaa and New Year's and all the other holidays that happen around this time of year, it's very important that we adjust what we normally would do for the COVID year. So we are again asking you to limit the size of your gatherings to 8 people max and no more than 2 households. Ideally, you would stay with only your own household. I know this is difficult. I enjoy as much as anyone else getting together this time of year. Clearly, it is a highlight of this last few weeks of any year. But if you get together with people with whom you do not live, you should assume someone in that group is infected. And if you eat and drink and take your masks off, you should assume you are at high risk for getting infected. The disease is that widespread at this time. You should always wear a face covering or mask whenever you are out in public, and you should not go into a public place where other people are not wearing masks, including yourself. Taking a mask off in an interior space at this time when you are with other people is high risk of spreading disease. You should always stay 6 or more feet away from people with whom you don't live. Remember, it is distance plus masking. It has to be both. It's not one or the other, it's both. So you need to keep that distance and wear a mask. And if you do those 2 things, the likelihood of you getting this infection is extraordinarily low. But if you violate those 2 tenets, coming within 6 feet of each other or failing to wear a mask, you are at much higher risk of getting this disease. Please avoid any large gatherings. There should not be any of the traditional holiday parties or gatherings where large numbers of people come together. Remember, large is a relative term. In this case, really, large is anything more than 8 or so people, as we have described up above in the first bullet. Please don't go to large public gatherings of any sort. It's just not a good idea. Of course, we now know very clearly that outdoor activities are lower risk than interior activities. But when it's 20 or 30 degrees outside, most people aren't going to be doing a lot of outdoor activities. So please avoid large gatherings of any sort. We've come this far in this journey. We have had remarkable accomplishments so far in avoiding the worst consequences of this disease as far as overrun hospitals and being at the high end of deaths. Those are things we have not had in Kentucky, despite our losses. Oh, James, I think there was one more bullet on there. So if you follow this guidance, these are the things that we can do to keep ourselves safe. Yeah, there we go. And I do want to touch on this. If we do these things, we keep ourselves safe. And please avoid leisure travel out of the state. Just don't do it. You run the risk of bringing infection to the people you love most in other states, or having them bring infection to you. And so our travel guidance was updated on the website, and it's the Kentucky Department for Public Health's guidance that leisure travel should be avoided until further notice. As I showed a couple days ago on the slides from Dr. Burks when she visited us, this is the third large escalation of disease in the United States. It is much more quick. It is also much more sustained. It's 8 weeks and we have not yet reached the peak. And it is also much more widespread across the country. So at this point, traveling and mixing with other people with whom you don't live is markedly elevated risk of spreading disease. And if you look just around the states that neighbor us, even in Ohio and Indiana, and certainly in Tennessee, their incidence of disease, or their number of people with infection, is much higher even than in Kentucky, and that increases your risk of getting infected. So please stay home, enjoy your own immediate household, use virtual technologies to connect with others, and let's all look forward to 2021, where with each passing month, our ability to feel safer, our ability to begin getting back to normal activities will increase with each passing month. James, you can take this slide down now, thanks. And I have two last things to share. The governor already commented that the KY COVID-19 hotline is now prepared to begin addressing people's general questions about vaccine. So if you are curious about its safety or its appropriateness for you, they are prepared to answer general questions. Obviously, there is still limited information on a number of things you may be curious about. And as we get more information, the personnel there answering your questions will get progressively more information they can share. Things that you should not call that hotline for are asking to schedule appointments, asking when am I going to be able to get the vaccine, advocating for when you should get the vaccine. Those are things that they are not in a position to answer. So please save that hotline for people who have questions, who have information they're trying to find, and perhaps who have more difficulty navigating our website. For everyone else, our website, we will continue to update the vaccine page so that we put more information as we go forward. As we learn more about the guidance from the federal government and the subsequent phases for the vaccination, we'll also try to put information there so that people can have a one-stop shop to go and find more recent updates. I'm going to emphasize and augment some of the messaging the governor shared. We need everybody to please be patient. There is not clear guidance yet as far as who will be in the subsequent phases the governor has shared. And I agree that an age-based approach is the way to save the most people's lives and prevent the most disease as quickly and as cleanly as possible. People who suffer the worst harms are also the ones who end up in the hospital requiring relatively intensive therapies and treatment and extended hospital stays. And when they go in the hospital and occupy those beds, not only is it obviously terrible for them because they're that sick, but it's also not good for everyone else, because as the hospitals get full, then there's not the capacity to care for everybody else with both COVID and non-COVID conditions. So we will be open and share the criteria that we use as we go forward. But right now, since the second vaccine is just having its hearing today, and since the committee that advises, the Advisory Committee on Immunization Practices, has not yet issued subsequent guidance, we're holding off to be able to see what that federal guidance is. And then we will come back to Kentucky, and the governor will share with you how we intend to proceed to try to immunize the most people with the greatest impact in the fairest and most equitable manner possible. For those of you who are in phase 1A, and in this I'm thinking of healthcare personnel, and yes, I do mean dentists and oral hygienists and others who do non-direct, I guess what you would say, traditional medical care. All healthcare personnel by the CDC's guidance are in phase 1A. And when you call to ask for when are you up, it's not yet been identified when you're going to come up, because the quantities of vaccine have been sufficiently small right now that it's only the very earliest tier of healthcare personnel, the hospital-based ones, who are right now beginning to get vaccinated in the first week. That will change quickly as we enter January and go forward. So again, I ask, whatever your role in society is, each and every one of us play an important role. And please, we have this incredible miracle of a vaccine just over 10 months from our first patient that we found in Kentucky. I just need everybody to please be patient. And in the weeks and months ahead, we will share with as much clarity as possible when and how people can have access to the vaccine. And like the messaging campaign the governor shared earlier comments, everybody will have her or his turn. It's just a matter of when we get to sufficient quantities and we get the whole system up and operating. So, and I've told others, flexibility is absolutely essential now. For all of you who have played with an Etch-a-Sketch, it feels right now like all of this planning is written on an Etch-a-Sketch and somebody is shaking the Etch-a-Sketch a few times a day. As soon as we come up with clarity on things, the federal government learns more information, or we learn more information, and it requires adjustment. I think anyone who has served in the military or served in a time of war would say any field general has the same experience. You plan, and then you have to adjust to the circumstances as they evolve, and we are doing that. So Kentuckians, I think we are seeing the light at the end of the tunnel, and I think this is a wonderful, wonderful holiday gift for all of us to have this. And now we need to focus on how we together can look out for each other, be kind, be caring, and see our way to the other end. Let's make sure we focus on us and we, not I and me. We are all in this together, and together we will do much better. Thank you very much. And Governor Beshear, back to you.
Thank you to Dr. Stack. We'll start with questions, and I think I've got to grab a sheet of paper here as we're doing it. First is Alex Ebert from Bloomberg. Could you please share Kentucky's most up-to-date COVID-19 vaccination amounts? Earlier today, and this isn't as of now, it was 1,454. That's going to pick up significantly as we move. Has anyone in Kentucky experienced any adverse side effects so far after taking the vaccine? That's Trevor Peters from Fox 19. I have not been advised that we have had any adverse reactions to this point. All right, next will be Stu Johnson, and I'm going to grab a sheet of paper as we bring him up.
Thank you, Governor. Unfortunately and sadly, you announced today the 54 deaths of Kentuckians, and you mentioned the holiday around Thanksgiving. Do you believe that that was a primary factor? And if so, what does that say about the upcoming Christmas holiday?
That's a good question. We do believe, based on what we are seeing in other states, that our actions taken before the Thanksgiving holiday blunted the impact that it could have had. Now, we are seeing good change in positivity going down and now really holding steady in the 8% range. Our cases probably before Thanksgiving would be going down more, but at least they are no longer increasing right now at all, much less the exponential growth which we stopped. What it says for Christmas is we need to make sure that we do it right, that we understand that it can be a super spreader event. But I also think that people have had a longer time to see how dangerous the situation that we are in truly is. And so I've got a lot of confidence that most Kentuckians are going to do Christmas right this year, keep it really small, knowing a vaccine is out there. And how tragic would it be, because we want a larger group in Christmas, if we lost somebody we love and care about just months before they could get vaccinated. So just by having them over this one Christmas, we miss 8, 9, 10, 15 other Christmases with them. I think people see the stakes now. They can see the timing, knowing that we're going to defeat this thing by the end of spring or the end of summer. I think that hopefully changes people's calculations. Catherine Collins from WLEX.
Thank you, Governor. I've seen some reports that some Pfizer vials of vaccine contain an extra or even 2 extra doses. Is that something that you're hearing from hospitals around Kentucky? And could that mean that there are more than the 38,000 doses in this initial shipment?
Let's send that over to Dr. Stack because he just put out his opinion on that today. And let's hear from him directly.
Thank you, Governor. I'm sorry, I just printed a piece of paper and you hear that in the background. We'll stop here momentarily. So yes, whenever they fill these vials, they overfill just a little bit to make sure that they don't underfill the vial. And it turns out that a lot of sites were reporting that they were able to pull out a full 6th additional dose for a 5-dose vial. It may be there's extra material beyond that. The FDA issued some tweets. Even for me, it seems odd that Twitter has become an official communication platform, but they have shared that they recommend that those extra doses, if they are full doses, that they be used. And I issued a memorandum today to the 11 hospitals who currently have inventory in Kentucky that they should, in fact, feel permitted to use those while we await official FDA guidance via channels other than Twitter. And so they are able to do that. There is the challenge. There's inventory management and tracking that gets a little complex with this, but those are technicalities when it comes to such a scarce resource. And so the hospitals should feel free to use any full dose they are able to draw from those vials, as long as their pharmacy staff are confident that they are all equivalent. And I have confidence in the hospitals across the state that they'll be able to do this.
Thank you, Steve. It looks like since we've been up here giving our report today, the Supreme Court of the United States denied the Kentucky Attorney General's attempt to overturn the ruling in the Sixth Circuit that said we were treating all schools during this dangerous period the same and taking steps to protect the lives of those around us. So that came in. Shelby Smithson from WKYT.
Hi, Governor. Will the number of people who choose not to get vaccinated have any impact on the timeline of when the state will start relaxing restrictions and mandates?
We believe, I think the answer there is yes and no. We believe that enough Kentuckians are going to be willing to take the vaccine to where that won't be an issue, but there will be the amount of time it takes to get everyone who wants to take a vaccine. You know, they say nationally they want more than 70%, maybe closer to 80% of individuals to take the vaccine. Obviously, getting there is going to require us having more knowledge on younger adults. But I right now, where I see public opinion, I believe that we can get there in Kentucky. Certainly, we'll be able to. I mean, once we defeat this thing, we end every restriction that we've put in place for this. We may be able to loosen it as we go. That'll all depend again on how quickly the vaccine gets out. So it may be a lot of activity near the end as opposed to a gradual reduction. But our timing on all this depends on how much Moderna we'll get, because Pfizer looks like it's going to be, unfortunately, a little limited. Also on whether the other vaccines out there, number one, prove effective, and number two, are authorized. So if Johnson & Johnson, for instance, is authorized in January, that'll be significant additional quantities. If AstraZeneca does as well. It's amazing that we have the vaccines, but there's so much that we don't know yet on the timing. And it's about 12 different decision points that'll impact that. Joe Ragusa from Spectrum.
Well, I guess now I have two questions actually, because I kind of want to follow up with you a little bit more about the U.S. Supreme Court's decision regarding the ban on or the closure of religious schools. Get you to expand a little bit more on that. I mean, obviously, I can imagine how you feel about that. But the other question that I have is in relation to, when you plan on getting the vaccine, do you plan on adjusting your behavior at all, or adjusting your public appearances at all? Because I know you've been kind of cooped up in the Capitol, for lack of a better phrase, but do you plan on making more public appearances once you get a vaccine?
So first, on the order from the Supreme Court, I've tried to read it while doing the press conference, so I don't have I don't think I can talk about it substantively. But first, we didn't close any school. We just moved them to online virtual instruction. And I think that's important, because suggesting a school is closed suggests the educators aren't working with students to provide the best experience possible. And they are doing a heck of a job. And the second thing is in no way were religious schools treated any differently. We asked everybody to make the same sacrifice. Everybody, every school, not picking on anybody, just asking everybody to do the exact same thing. And guess what? We see with that and other steps, it having stopped an exponential growth that was threatening our hospital capacity. The things we put into place have worked. Now, we still have a lot longer to go in battling this virus, but I hope when we know things will work, that in the future, everybody will say, we'll do our part. We don't want to be the exception. We want to be a part of the solution. As for myself getting vaccinated, there's certainly the initial vaccination and the booster, and you don't get that 94, 95% effectiveness until after the booster. Then we don't know yet whether you can spread the virus. And certainly I'm not going to adjust my schedule significantly until I know that if vaccinated, I won't be spreading it to other people. Because, all along, I've been in a spot because of my age and my general health where I'd probably be generally okay if I got this virus, but the people that I could spread it to might not be. And until we know that I can't spread it, my schedule will be pretty much the same, being cooped up here at the Capitol, which is an apt description. Now, if enough of the Commonwealth get vaccinated, in many ways, it won't matter whether it can stop spreading, because enough people will be protected from the adverse impact of it, and that'll work. I mean, we'll get where we need to go. Tom Latek from Kentucky Today.
Good afternoon, Governor. I want to go back to the Supreme Court, Kentucky Supreme Court decision. $1.3 billion, that's like 10%, an additional 10% into the state coffers. What steps do we still have to see before you can actually go after and get that money? And how would you recommend to the General Assembly it would be spent?
So first, the decision will have to become final. There's a certain number of days that they can request a rehearing, and I'm sure that'll happen with a decision like this. But once that is over, then you can commence steps to try to collect these dollars. Now, it's a very large judgment, and we don't know. I don't know that Poker Stars has that quite on hand. So sometimes what this does is lead to a significant recovery, but potentially not the full amount based on the solvency of the company. But we are going to aggressively seek these dollars. They have kept us as a Commonwealth in court far too long. And remember, it was them engaging in criminal activity. At different points where there's been opportunities, I think that they have not done the right thing. And they're going to have to step up and do it now. We'll talk to the General Assembly about it, but this may add into what can be a positive budget situation. And let me say, as we start here in January, in the midst of this pandemic, but also knowing that the post-pandemic economy is going to be entirely different, we got to do two things. Number one, we got to provide relief. Let's think about ways we can provide relief to those who haven't been able to get those unemployment dollars, how we can help them bridge that time. Let's think about those still worried about getting kicked out of their homes or not being able to pay their electricity or water bills. Let's think about those small businesses that have been hurt and whose future is uncertain, even with federal help that may be on the way. And then let's be bold. Let's think about investments where we can lead a post-COVID economy. Other states are going to make those and they're going to run ahead. Are we simply going to watch them and then years later try to replicate something after our chance has passed? Because of some strong fiscal management, we're going to be in a position next year to truly help our citizens out, but also to set ourselves up for success moving forward. That's an opportunity that we can't let pass us by. Karen Czar from WUKY.
Thank you, Governor. For you and for Dr. Stack, we've gotten questions from listeners discussing the differences between the Pfizer and the Moderna vaccines. Is there one that either of you prefer over the other, or you have equal confidence in both and you're just going to be happy to get one or the other? Thank you.
Well, from my standpoint, and then we'll go to Dr. Stack, Pfizer right now has been through the emergency approval process. Moderna hasn't gotten through that yet. Provided it does, and all things being equal, they appear to be 95% effective. Each Pfizer has a 3-week time period between initial shot and booster. Moderna has a 4-week time period. But if you're asking me, in working on the logistics of getting the vaccine out all over the Commonwealth, Moderna doesn't require the deep refrigeration. And so in many ways, that makes it easier to get out to people. Dr. Stack?
So I agree with the governor that there are differences in the timing and the logistics, but I would say if you are willing to receive a vaccine, and I hope the vast majority of you will be, then I think you should take whichever one you could get. It appears that though there are different timings and storage characteristics, the performance of both is functionally equivalent. And so you would get similar protection for both of them. So I would take the first one you can get. Let me add one other thing, and I'm glad the governor called on me. One of our staff members just shared with me a text message someone sent that appears to be fraudulent activity. The State Department for Public Health will not text you to tell you we have invited you to receive the first, quote, human COVID-19 vaccines. So like many other sad and tragic fraud attempts, people try to scam folks at times of distress. The State Department for Public Health will not text you inviting you to get vaccine. So please do not respond to those outreaches. There will be formal and appropriate outreaches that will let you know when it is available.
And here, Dr. Stack, I thought you were texting me about my vaccine. All right, John Boyle from WFPL.
Hi, Governor. The 7-day positivity rate our team has calculated is around 16%. The rate of around 8% that you keep using, it only takes 10,000 positive cases into account, according to the daily report from yesterday. But we've had nearly 22,000 cases in the week leading up to yesterday. So only half of our cases accounted for in this because they're the only electronically submitted PCR results. And if so, how's that positivity rate that omits more than 10,000 cases useful?
Yeah, we'll go over to Dr. Stack on this, but we are confident in our positivity rate. It comes not from the number of cases we report, but directly from labs, meaning we get the negatives or all and the positives from a different information source than we get our cases, which come from our local health departments having confirmed them. So, Dr. Stack?
Yeah, this is one thing I'll look forward to when this part of the job's over, is trying to parse all of this data over and over as we've explained it repeatedly. The test positivity is a surrogate for adequacy of testing available to people. All of these are sample sizes. We never capture 100% of all the tests done. There's just not a methodology that makes that possible. On our peak days in the state of Kentucky, we have 40,000 or more electronic test results reported for COVID-19. It is a sample size that is spread across the entire state. It is representative, and it is well beyond any rigor needed to get an adequate sample size to tell us what the test positivity rate looks like. Any other measure where you're relying on trying to take numerators and attach to them a denominator you speculate or otherwise try to create through manual processes doesn't align the numbers as well. And so while there is no perfect methodology, I have strong confidence that the approach we are taking is a broadly representative, enormous sample size relative to our populations throughout the entire Commonwealth, and that the test positivity report value that we report is a fair, reasonable representation of the testing adequacy across the state of Kentucky relative to the disease burden. So I guess that is as declarative as I can be on that, but I have confidence in it. Even if others calculate it different ways and reach different results, they are welcome to play those number games. What we have done, we believe, is the most appropriate and reliable way we can do it in the state of Kentucky, using the tools we've developed over 10 months in this journey to get to a better place. Governor, back to you.
All right, Debbie Yetter from the Courier-Journal to close us out.
Hi, Governor. I wondered if you could describe what you know about how the long-term care vaccinations will proceed next week. And also, is that second shipment of Pfizer also for long-term care? And does that mean extra doses for residents and staff?
So the shipment of the Pfizer is not the second dose. So we know that there are second doses coming for that 30,000+ as well. We actually have seen it in writing, and it's being held back by the federal government. We believe that as early as Monday, that Walgreens, in the very least, will be starting vaccinations across the state. We are still seeing what their final plan is for Monday, but we hope to have press availability in and around when the first facility are getting those vaccines. Now, we're not going to do it at the facility. It would not be appropriate to bring more people into a place where people are the most fragile and most likely to have an adverse reaction and pass away from the virus if they get it, not from the vaccine. So we'll be putting that plan out. It's an aggressive schedule from Walgreens and CVS. Our hope is to get everybody in long-term care all the way down through assisted living vaccinated by the 1st of March. The amount of the Pfizer vaccine being less complicates that, but we're still committed to trying to get that done. All right, everybody. Thank you. We'll be back again on Monday at 4. Remember, be really careful out there. The White House has said if you're over 65 or you have any type of underlying condition that COVID preys on, don't go inside anywhere where people aren't wearing masks. It is that dangerous across the country right now. And please, I pray that we will all come to the right decision about how to spend how to spend Christmas. Mine will be with Brittany, Will, and Lila, and of course, Winnie. And that's going to protect my parents, my kids' grandparents, who have a lot more Christmases left to spend with them. Thank you all very much.